Ji, Mohsin, this is a short case for you, and you're going to talk about ulcer. Ulcer की बात करें ना. So the command will be something like this. Ulcer है कहाँ पे ये?
Sir, on the interior aspect of the right leg.
Okay.
Lower
Then
leg.
the command would be something like this. Okay, Mohsin, please examine the legs.
Sir, thank you, sir. 20 years of age male presented with a hockey-shaped ulcer on the interior aspect of the right lower leg. It measures 4 into 1.5 centimeter in size. Surrounding skin is red, edematous, indurated, and inflamed. Margins of the ulcer are irregular. There is clotted blood or scab at the floor of the ulcer. There is small amount of visible watery discharge at the center and on the medial aspect of the ulcer. Temperature of the surrounding skin is raised as compared to the normal limb. Ulcer and area around the ulcer is tender. Edges of the ulcer are punched out and base of the ulcer is not fixed to the underlying structures. Distal neurovascular status is intact and inguinal lymph nodes are not palpable. There is no varicosities or other deformities on the legs. That's it.
Okay.
And there is a history of trauma few days back while he was riding the motorcycle, and he got hit into a car. So after that, he developed this ulcer, sir.
So why do you say it's an ulcer?
Sir, because there is a break in the dermis. There's a break in the skin like epidermis and dermis, and the underlying subcutaneous tissues are visible. So that's why I say this is ulcer.
Okay. So what is the cause of ulcer?
In my case, the cause of ulcer is trauma. So I would say it is a traumatic ulcer, sir.
You say it's a traumatic ulcer.
Sure.
And what is the state of this ulcer? Is it healing or not healing?
Sir, it is not healing. It is an infected ulcer at present because the surrounding skin is red, edematous, inflamed, and there is watery discharge from the floor of the ulcer as well. So
that is why you are saying it is infected.
Sir.
Any other signs of infection?
Yes, sir. Sorry, sir. Kindly, can you repeat?
Any other signs of infection?
Sir, there is no fever, and there are no other signs. I could get only two signs, that is red edematous indurated skin surrounding the ulcer and the watery discharge.
And the watery.
From the, sir.
Should there be tenderness?
Sir, tenderness is also there at the base of the ulcer as well as in the surrounding area.
आपने mention
So it is a tender ulcer.
आपने
Right.
mention नहीं किया. It's okay. It's okay.
Right.
It's okay. How do you want to treat this case?
Sir, I want to go for debridement of the ulcer, and along with that, a course of antibiotics against gram-positive, commonly the gram-positive organisms.
So you want to do this thing without any investigation?
Yes, sir. I will want to do complete blood counts to look for TLC count, and then yes, sir, hepatitis B and hepatitis C.
Why you want to?
Status of hepatitis B and C, and PT and APTT.
Any other investigation? Any other investigation?
Sir, these investigations will suffice as this is a small ulcer, and I will do debridement in local anesthesia. So I will need TLC count and hepatitis B and hepatitis C status prior to debridement.
And what you want to
Okay.
debride?
Sir, I want to debride the floor because there is clotted blood and scab, and there is watery discharge, and the edges of the ulcer as well, because these are non-healing, and there are skin changes at the edges of the ulcers. So I want to get fresh margins.
What is the difference between wound debridement and excision? देखिए इसमें मोर ऐसा पूरा अल्सर ही निकाल दिए आपने कहा फ्लोरिंग
Sir,
निकाल दूंगा आपने कहा मैच भी तो व्हाट इज द डिफरेंस बिटवीन एक्सिजन ऑफ एन अल्सर एंड debridement of an ulcer?
Sir, in debridement only dead tissues will be excised, while in excision of the lesion, all the lesion is excised along with the a normal area.
So what do you
That
say
is,
about margin of the ulcer is not dead as you have told, and still you are removing it?
sir, margins. Yes, sir. I will also like to freshen up the margins.
So that debridement, that is excision.
So that will make it excision of the ulcer, sir.
It's just this ठीक अच्छा okay, and you want to give antibiotics ठीक होगी बात. And the ulcer will, what else?
Then repeated dressings, to change daily dressings for a week or so, and then follow up visit.
Why daily dressing?
Sir, because the dressing will be soaked with a discharge is present. So I would want to look for soakage of the dressing and state of the wound. So I will want to change the dressing daily, and it will help me
and you
in
will
getting.
do, and how will you do dressing?
I will do sir, simple pyridine soaked dressings with the simple gauze soaked with pyridine, and then crab bandage in a circular fashion.
So what is
Around
compound
the
pyridine soaked dressing? आपने जो इस्तेमाल किया simple pyridine. So I just want to know, is
Right.
there a compound pyridine soaked dressing also?
I don't know, sir.
No. Okay. ठीक है, we'll come to that. तो इतना ही टाइम होता है शॉर्ट केस में 10 मिनट तो हो गए. It's not much.
Sir.
I'm coming to the feedback now.
Sir.
If this much to give an answer in a short case of an ulcer, and the
Sir.
discussion remains focused on traumatic, then possibly it is sufficient to pass you.
Sir.
But there are certain things जो ज़हन में आपने रखनी होंगी, and you can score much
Sir.
more if you tell those. And there are certain points जो कि जरूर बताने चाहिए थे कि जो कि आपसे मिस हो गए.
Sure, sir.
For example, जब मैंने investigations पूछी, तो you told me blood complete picture. Now
Sir.
you're saying it's an infected ulcer.
Sir.
So swab for discharge for CS.
And discharge for CS.
आप infection कह रहे हैं.
Sir,
आप broad spectrum antibiotic start कर रहे हैं. It's okay if you are starting it, but before that, as far principles are concerned, then discharge for CS, that should be taken.
right, sir.
Isn't it?
This is right, sir.
Other thing is, if it's a traumatic ulcer and the cause of trauma is so sufficient that it has caused necrosis of the skin, which will result in formation of ulcer,
Sure.
then having an X-ray is also a good idea. to see the underlying bone.
Right, sir.
Then it's an ulcer in the leg, and the healing of the ulcers in the leg are slow to heal. So it's always a good idea to go for investigations which delay the healing. For example, blood sugar. Diabetes is pretty common in our setup, and many times patients are discovered incidentally. So in such cases, possibly it's a good idea to go for blood sugar also in investigation.
Right, sir.
Except possibly CS, since you have committed infection, आप कह रहे हैं.
हाँ.
बाकी आप मिस भी कर जाते हैं तो ऐसी बात नहीं. अगर आप CS मिस भी कर गए, it is not a mistake which can result in a failure, but possibly ये आपका अगर let us say कि it can give a ठीक है, मतलब ये चीज होनी चाहिए.
Right.
Then dressing.
Sir.
Dressing की बात ठीक है. Dressing, important concept is that the dressing should be आप जिस तरह इसका डिस्चार्ज है तो ड्रेसिंग आप बेशक आप डेली चेंज मत करें, बट वन शुड चेंज जब वो आपको नजर आए कि खराब है. मगर चूंकि इन्फेक्टेड अल्सर है तो अगर आप डेली कर रहे हैं तो ठीक है, बिकॉज आपने जो उसमें एक रीजनिंग दी वो ठीक थी कि आप उसमें दिखना चाहते हैं. Other thing in examination which goes against infection is you said it's a watery discharge.
Sure.
If it's an infection, it should be a purulent discharge, a stucker discharge. But again, infection may not be in the ulcer. Infection may be around the skin, and since ulcer is a component of that, so we will call it an infection. So, but ठीक है.
Right.
And then you do. As far as debridement and excision is concerned, the question which I was asking was to differentiate between the two terms. And that is true what you have told. Debridement is excision of dead or obviously dead tissue.
Sir.
A dead tissue or a tissue which is suspected to be dead. Usko aap debridement कहते हैं. Excision is a formal.
Sure.
And in excision, whatever is excised, it is excised through the normal.
Sure.
Take it out. That's the difference between excision and debridement. Excision is more formal, and usme you go up to, in fact, very healthy margin. But in debridement, what you do is this thing. Now, what is going to happen is, as in this case, the time is not going to be jitna aapne time diya hai. Let us take, if you're giving answers like this, and it's a short case, the 2 minutes or 2.5 minutes might be left.
Sure.
Then one can go to other things. अच्छा डॉक्टर साहब infection खत्म हो गई है, that infection is finished. Or what other type of dressings you can give?
Other type of dressings. Infection खत्म हो गई.
Are there other materials available to do dressing than gauze?
I don't find the answer, sir.
Then he's talking about is possibly market में जो आपके ऐसे duoderm है और ये चीजें available हैं. He wants to hear that these are also available for dressing. Then possibly also that when we apply these dressings, for how much time period it remains applied, and when do you change them?
Right.
And then possibly the question will always come, okay, when you apply this swelling, so what happens if the discharge occurs? So then one should have the concept, okay, in these dressings, many of these dressings, because normally some discharge occurs from the side, which is not infection.
Sure.
So questions like this might come up slightly. But then again, these questions are not the deciding factors in which you pass or fail. These are the factors which add additional numbers to you.
Right, sir.
Then if the time will come, then one can start asking, okay, Dr. Saab, let us say if they are varicose vein,
Sure.
then what would you do? Then the concept is, okay, if an ulcer is secondary to something, as in this case,
Sure.
accident हुआ कैसे था ये?
Sir, he fell from the bike while hitting a car.
Okay. Why I am talking about this concept is कि ulcer and the disease which is causing it, may that be varicose, may that be an arterial disease, may that be trauma, may that be per se primary infection of the skin like tuberculosis, or may
Right.
that be a primary disease of the skin which may be a cancer.
Right, sir.
The ulcer and the disease, their treatment and management go side by side.
Right, sir.
When you're talking about history, then you're talking about history of the ulcer and the history of the disease both. It's a varicose ulcer
Right.
of the history and history of varicose veins. If it is arterial disease, history of ulcer and history of any arterial disease. The common
Right.
point. Like in this case, trauma ulcer, the history of ulcer, onset, how it started, it progressed, aggravating, relieving factors, treatment, defect treatment. That is one history, and history of trauma, like you have told.
Sure.
After that, when you do for examination, then also examination of both ulcer and the cause. And the cause which is suspected also in detail. It's a varicose,
Sure.
then ulcer and varicose veins. Complete examination.
Right.
Ulcer, arterial, ulcer and arterial examination of the limb completely.
Right, sir.
Nervous, both. If you're suffering with diabetic ulcer, then ulcer and examination of the foot complete with the perspectives of diabetes mellitus, which will include flow and sensations and these things. वो साथ आएंगी. Therefore, also when you will go for investigation,
Sure.
again, both things again, one set of the ulcer and one set of the disease. For example, in ulcer, the set of tests are discharge to be sent for CS. If there's an infection in ulcer, blood CP वगैरह and blood hemoglobin, तो हर एक में होगा to see because it has to heal and you want to know the hemoglobin level.
Sure.
Plus diabetes to rule out such things so that the healing should occur. At the same time, you have to do is the investigations of the disease. For example, if it was a varicose ulcer, then you would go for Doppler along with it. If it's an arterial, Doppler along with it. If it's an ulcer and on its own merit, which it will now because of ulcer has formed, you will all beg investigations of in arterial disease in addition to Doppler angiographies, CT angiographies and these things, which may add on hoti jayengi. If it's a diabetic, then glycosidated hemoglobin. And these investigations will start. So this is how the investigations are also going to jump into it. Then once you come to the treatment,
Sure.
now once you are going to come to the treatment, in treatment also, both treatment will start simultaneously. For example, in this case, an important aspect of treatment was because you will advise the person not to go on the bike or be careful in the bike
Sure.
so that the same point may not get hurt. So that will become a part of treatment. In varicose vein, even if you're not going for, let us say, surgery, then conservative treatment of varicose vein, that will start with it. You will advise him graduated elastic stockings ताकि वो healing में मदद करेगा. Similarly, if it's an arterial disease, the conservative treatment will start straight away. You have to optimize the cardiac function, you have to optimize the hemoglobin, you have to optimize all these things, you have to stop smoking, and all these points will add at the same moment.
Sure.
If it is, let us say, if it's you are suspecting a carcinoma, then
Sure.
in addition to also treatment, Biopsy of ulcer is a mandatory because that comes in investigation.
Sure.
If it's a tuberculosis, then culture on lymph genital medium and a biopsy becomes a part of the treatment. If it's tuberculosis, anti-tuberculosis become a part of treatment.
Sure.
The ulcer. And if it turns out to be carcinoma, the treatment of carcinoma per se, may that be radiotherapy, may that be oxygen, will become a part of the treatment of ulcer. What I mean to say is, all the things go together.
Sure.
So do not get your thought wander off. अगर वेरिकोज वेन आ गया, आप कंसिडर वेरिकोज वेन की ट्रीटमेंट भी करना शुरू हो गए, और अल्सर की आप भूल गए कि हाँ ब्लड सीएस भी करवाएंगे, उसके बाद उसके लिए भी आप एंटीबायोटिक स्टार्ट करेंगे. You get the point. So this is the main catch in when we're talking about ulcers in a short case or in a long case. This is the general concept.
सर स्टेप्स ऑफ एग्जामिनेशन थोड़े से बता दें, किस तरीके से इस अल्सर की एग्जामिनेशन में हमने जाना है.
ओके, लेकिन जब हम स्टेप्स ऑफ एग्जामिनेशन की हम बात करते हैं अल्सर की, तो अल्सर और ये चीजें जो हैं, दे आर swelling and ulcer have everything common. So history की हम बात करें तो obviously you have to introduce, you take consent, you have to exposure and position. Limb पे है तो obviously their exposure include the normal limb. If ulcer on is on the limb, lymphatic area. If there is ulcer, you have to remove the dressing. You have to ask few questions pertaining to the disease, few questions pertaining to the ulcer itself. And then when it is exposed, now two types of examination are going to occur. One is of ulcer and one is of limb, whatever it is. So जहां तक inspection की बात है, तो अल्सर की बात में तो उसने बता दिया, you have to site, use anatomical landmarks, the shape है, regular है या irregular है. Regular means you can give a name to the shape. Discharge कैसा है, it is serous, reddish, pus, surrounding skin कैसी है. And most important is the ulcer shape, margin, edge, floor, and base. And the most important is the margin. Base is, floor is what you see and base is what you feel. That's the difference between floor and this. Edge is the shape between the margin and the floor. That is called as edge. For example, if you see this thing, if I say this is an ulcer, as you are seeing, this is the margin, this is the floor, and this part is the edge. I am seeing the floor, I cannot see the base. The base can only be felt. Palpation, obviously, tenderness and temperature of the surrounding skin. Possibly temperature भी आपको बताना चाहिए क्योंकि आप infection कर रहे हैं. Then obviously base कितना deep है. Obviously depth will be millimeter, 1 millimeter or something one can mention. And what about regional lymph nodes? जो कि mention करने चाहिए. इसमें infection है, so it's always good to tell specifically there are no lymph nodes palpable because that's a good positive point. And obviously distal neurology is important. If diabetes, then vibration and deep reflexes, they also come in, and distal vascular. Now, when you're talking about describing the ulcer, so you are going to talk about this patient has an ulcer, it is present in the here and there, it is present on the, let us say, in the lower part of the leg. Its shape is regular. Regular means you can give it a name, like this is a circular shape. This margin is round, so it's a circular shape. Size is this centimeter, its margin is regular, and this thing, and edge is, as in this case, if you see, if you take it out, it's a sloping edge. This is one point, this is a deep point, and I can call it a sloping edge. If you forget about this edge, so it has a sloping edge. Its base is hard as it is, and the ulcer is tender or not tender, the surrounding skin is tender or not tender. And what about temperature and distally, pulsations are present or not present, neovascular status, there's distalness, sensory loss or not, and proximal lymph nodes are present, not present, and standing. And then you ask the patient to stand and also tell that there are varicose veins present or not present. If the patient is already standing, if the varicose veins are present, then after this, the examination of varicose vein will start. As if it's an arterial ulcer, then the examination of the arterial system of the limb will start and will become a part of this. About edge. Now 3 minutes are left. So when it ends, so it means it has ended. Most important thing is edge. If you commit an edge, you are committing a diagnosis. If you commit, it's a sloping, then you are committing either a varicose vein or a healing ulcer. If it's undermined, then you are committing tuberculosis or bed sore. If it's an area where fat is present, like buttocks, etc., then it's a bed sore. Whereas tuberculosis, everted squamous cell carcinoma, punched out. Again, if you're saying it's punched out, you are committing an ischemic ulcer or a bed sore. If it's a rolled up, it's a basal cell carcinoma. Now, floor is the visible portion. You can comment upon healing of the ulcer by looking at the floor. If it's a healthy granulation tissue, it's a healing ulcer. If it's a poor granulation tissue, where you can see slough, you can see pus, you can see discharge, then it is not a good healing ulcer. So these points one has to keep in mind. So I hope that answers the question which was asked. Okay, what we do now is, it's ending now. So I'm going to finish it, then we're going to come back and we are going to discuss one more short case before we go.
Let's